Hi, I'm Dr. Heather Richardson. I'm a breast cancer specialist at Bedford Breast Center, and I've been practicing since 2004. Unfortunately, I lost my own mother to breast cancer, so I know exactly what it's like from both sides. Whether you've always been expecting it and now here you are, or whether you're totally blindsided, one of the first things we want you to know is that take a deep breath. There is time to take care of this. No matter how you are taking this new breast cancer diagnosis, or maybe you're here just to gather information from a loved one, it's a very shocking, very unsettling thing, and I'm so sorry that you're having to deal with this. However, there are some things that we want you to know. It's going to take a few weeks to gather this information, and it's completely safe to do so. You'll need to see what additional imaging needs to be performed, what genetic testing might need to be performed, what surgical recommendations there are, and whether or not plastic and reconstructive surgery is indicated, and lastly, what additional treatments might need to be performed and in what order, such as medicine like chemotherapy or radiation. When a patient has a breast cancer diagnosis, imaging is one of the first things we want to know about. How big is this cancer? Where is it in the breast? What are the healthy tissues? What are the unhealthy tissues? So that we know what is possible to be saved and what needs to be removed with surgery. Your doctor can help guide you through the necessary steps and the options in testing so that you have the best information to make your treatment plan. Most patients who have breast cancer think that it's probably due to a broken gene or has been passed through their family, when in reality, it's probably fewer than 5 to 10% of all breast cancer cases are associated with a broken gene. We do recommend, if you have a breast cancer diagnosis, to talk to your doctor about getting tested for any mutated genes. More than likely, it won't be positive, and more than likely, we won't have a clear indication of why you have the breast cancer. However, it's a good idea to arm yourself with that information, as if you have a broken gene, you may decide to do more aggressive surgeries, such as a double mastectomy, or if you don't have the gene, you may elect to keep more of your breast tissue and perhaps do a lumpectomy or breast conservation therapy. If you do have a broken gene, or depending on your gene testing results, this will also empower your family to get more information and may protect your healthy loved ones. Surgery options primarily are in two groups, either mastectomy surgery or breast conservation surgery. If you choose mastectomy surgery, that typically means that we're removing the breast gland tissue. For most patients, you can leave the skin and leave the nipple and perform reconstruction and still have a really good looking feminine breast. If you have a fairly small area of cancer and a fairly large breast, and all of that's relative, you can talk to your doctor about a simple lumpectomy, and that means just removing the site of cancer and leaving the rest of the breast tissue behind as a breast. For the most part, we recommend performing radiation on this tissue after that. However, some people may not need radiation even after lumpectomy. Especially talk to your doctor if you're over the age of 70 about not needing radiation after lumpectomy surgery. Some patients need chemotherapy and some patients don't. How do we make these decisions? The decision to need chemotherapy really depends on the characteristics of the individual cells themselves and whether or not they have special features that allow them to break away from where they were born and float and land in other parts of the body and cause problems there. There are a lot of really good reasons to use the chemotherapy before surgery. There's a really great feeling in watching the tumors that we're seeing melt and shrink and knowing that the chemotherapy is working. It's also important to see sometimes that if the chemotherapy is not working as well as we expected, we may want to change or add additional medicines. We're really glad that you found us. I hope that we've been a hopeful, helpful, positive source of information. Please take some time to make sure that you're getting the best treatment for you and that you talk to your doctors about some of the things that we've talked about here.